Hello, my name is Angela Reid and I'm a Senior Professional Officer with the Northern Ireland Practice and Education Council for Nursing and Midwifery. NIPEC has been asked to put together this short guidance video on record-keeping practice by the Chief Nursing Officer for Northern Ireland, Professor Charlotte McCardle, to support nursing and midwifery staff during increasing demand on services as a result of surges of the coronavirus pandemic. Recognising the significant impact on nursing and midwifery services particularly, the 4 UK Chief Nursing Officers have had to make rapid policy changes to ensure that all nursing and midwifery care in the context of COVID-19 is as safe as is reasonably possible. In terms of regulation, the Nursing and Midwifery Council, or the NMC, has recognised the difficulties that registrants are currently facing in 2021. In a joint statement with the UK CNOs in November 2020, the NMC said, "We must continue to adhere to the core principles of nursing and midwifery practice. As registered professionals, we should always practice in line with the NMC code and use our professional judgment, taking account of the realities of an abnormal emergency situation. We want nurses and midwives, in partnership with patients and people they provide care for, to use their professional judgment to assess risk and make sure people receive safe care, informed by the values and principles set out in their professional standards. It is the responsibility of the organisations in which we work to ensure we are supported to do this. They must bear in mind that clinicians may need to depart, possibly significantly, from established procedures to care for patients in the highly challenging but time-bound circumstances of the peak of a pandemic." Underpinned by the UK CNO Enabling Professionalism Framework, NIPEC has worked from best available evidence in partnership with the HSC trusts and staff-side organisations to produce guidance on a range of subjects on a microsite entitled Enabling Professionalism During Surge Demand. In this short video, I'm going to cover the guidance offered in relation to record-keeping practice. This guidance is specific to periods of surge demand only, recognising that the NMC have offered guidance relating to regulation and risk-based professional judgment during periods of surge. The principles outlined on the microsite are aimed at assisting your thinking, particularly when shift teams are made up of staff who are unfamiliar with the clinical environment. There's more information on the microsite in relation to considering competence to assess and evaluate nursing need if you're redeployed to an unfamiliar area of practice. This can be accessed via the main NIPEC homepage at www.nipec.hscni.net. Where periods of high levels of service demand are likely, it is especially important that information being captured around assessment of nursing or midwifery need linked to a plan of care is appropriate, current, and accessible. Nurses and midwives, however, may find themselves in situations on occasions where it is not possible to carry out a full assessment for patients in their care for a variety of reasons. Person-centred nursing and midwifery assessments have different sets of criteria depending on specific care settings. And each person that enters a clinical setting to receive care and treatment will have individual health and well-being needs. It's therefore not possible to describe a full set of nursing or midwifery assessment criteria that you assess for every person entering a service on every occasion, regardless of the care setting. It was important, therefore, that the principles outlined on the Enabling Professionalism Surge Demand microsite could be adapted to any type of assessment completed. However, after the registrant has recorded the usual demographic and next of kin information there are certain elements of the assessment that must always be completed for everyone, which I will tell you about now. Critical areas that must always be assessed and recorded for all patients on initial admission to a service have been agreed as alerts, allergies, do not attempt resuscitation orders, and psychological assessments, and then risk assessments relating to infection prevention and control and moving and handling. After that, and where it is not possible to complete a full assessment at that time, professional judgment should be used to prioritise the most relevant assessment criteria and other risk assessments to the immediate presenting need of the person being cared for. Nurses and midwives have the professional expertise to understand what needs to be immediately assessed in an acute phase of illness. So, for example, a 45-year-old woman presenting with acute pancreatitis will have a different set of nursing needs to an 85-year-old man with complex comorbidities who has been admitted in respiratory distress. It is down to you as the admitting nurse to determine what needs to be assessed immediately and what can be deferred to others taking over from you later on in a shift. Where assessment criteria have been omitted, you should record those areas which require further review in the adult record, for example. This is at page 15. There is a section for you to do this. And it's good practice to include a short reason as to why it was not possible for you to record responses to all of the assessment criteria at that time. All registered nurses and midwives are responsible for the assessment of need within their scope of practice. Therefore, subsequent teams coming on shifts later on and following you should review the incomplete assessment, adding to it where they can, again tracking those areas that they were unable to cover for the next team of nurses taking over on the next shift. There are also elements of the record which had been requested through the usual process of co-production with staff as an aid memoir, which may not necessarily be helpful during periods of surge demand. Again, based on the professional judgment of the assessing nurse or nurses. An example of this is the summary of assessed needs on page 14 of the adult record. I hope you find this short video useful. Please do not hesitate to contact NIPEC at inquiries@nipec.hscni.net should you have any further questions. Thank you.